Okay, skill I'm going to perform is spiking and priming IV fluids using primary tubing, and then I'm going to initiate infusion to my patient. So what I need is a bag of primary fluids, which I have 0.9% sodium chloride or normal saline, 250 milliliters. I have my ClearLink Continue Flow solution set, primary IV tubing, which is intact, and up here is my drops per minute if I wanted to do my math problem. And I need a flush syringe when I go into the room to check my patient's IV for patency. I need alcohol swabs to scrub my hubs, and I'll need a pair of gloves for when I go into my patient's room. So to spike and prime my bag, I could do it outside of my patient's room, then take it in. I'm going to wash my hands prior to start with clean hands. And I'm going to get the supplies I need. So I need my primary bag and my primary tubing. I'm going to hang my bag on my IV pull or somewhere where it's elevated to help with gravity. My tubing is perforated on the side, so if you just pull it down, it will rip to get out your tubing. When you open up tubing, it will have a paper wrap on it that you'll need to remove. And then I always suggest that you close your roller clamps when you open tubing. This way, once you spike your bag, it just won't flush out without you being able to control it. So
can you show that roller clamp and how you close it?
So the clamp is a roller clamp, and it has this roller, and it moves freely on your tubing. And when it's up towards the top, that's the top, it's wide open. To close it, you just roll it down your tubing all the way to the bottom, and now it will not move, so it's closed. And when we regulate the speed or how we want to infuse it by gravity, we regulate it by rolling that clamp to different degrees of opened or closed. If you use your IV infusion pump, you're just going to keep it open in your pump, and your pump will regulate your speed. But to spike our bag, fluid will come right out once we put our spike through the bag. So before we do that, it's always a good idea to close your clamp so your fluid won't go anywhere until you're ready for it to go somewhere. And then part of our tubing, we have the spike, which that is a plastic spike. It's pointed, and that's what we're going to break the seal of our IV fluids so it can infuse, and it should have a cap on it so it stays sterile and safe. This is our drip chamber, so we're going to prime that with fluid prior to priming our tubing, and you always want to make sure there's a little bit of fluid in your drip chamber so as air does not get into your tubing as it is infusing. Down your tubing, you'll notice different things. This, I call it a little flying saucer thing. That's a backflow valve, so it prevents fluids from going backwards up into your primary system. That's more important when we have a secondary bag attached to it, so that would be protection against backflow. And then you'll have a multitude of injection ports, so that's what these are, injection ports, and that's what we could use to piggyback fluids into a primary line or add a secondary line. We could administer IV push medications through there, so you'll see those used for a variety of reasons. We have our roller clamp. We have a little slide lock, so similar to the one that you'll see on your IV extension tubing. It just slides and locks it, so for quick stop if you don't have the roller clamp. And this actually is Baxter tubing, so that's important when you're loading a Baxter pump. And then you have the other end of your tubing, which goes and attaches to your patient's Heplock IV, and that should be covered.
What's important about that?
What?
That end piece.
That it has a screw on it?
I mean, can I lay it down?
No, you want to keep it covered and sterile, because if this becomes contaminated, remember, it's going to be connected to your patient's IV into their bloodstream, so that needs to always be covered when not in use. So make sure that that's protected. If you ever come into a room and that's not covered, you will not be able to reuse that tubing, so it's a very important piece. Okay, so I have my tubing. I'm going to make sure my roller clamp is closed and that I have the end with the spike on it, and I have my IV fluid bag up here. We could check this against the order, make sure we have the correct type of fluids, make sure we have the correct size of bag of fluids, because it won't always be the same size. You may have 100 milliliters, 250, 500, 1,000, and etc. Want to make sure that it is unexpired and it is safe to use. And this bag is good in all those categories.
Why does it have 2 ports?
So I'm just going to show you the
Okay,
ports
great.
on here. So there's ports at the bottom of the bag. This one, can you see it? With the red cap is where I'm going to take off and I'm going to be able to spike it. This one with the white clear cap is for your pharmacist. If they were to have to mix you up an antibiotic or some type of medicated fluid in a 250 milliliter bag of normal saline, which this is, your pharmacist would use that port to put other chemicals in this bag to prepare it for your patients if needed. But we're just going to do it as normal saline, so we don't need anything added to our bag. If there was, it should be labeled and for that person. But this is just a bag of 0.9% sodium chloride, which is the maintenance fluids we'll say for our patient. The red cap we're going to pull off, so just pull straight down. And if this is a brand new bag, nothing should happen. Because I know you probably can't see in there, but there's a seal right in that port. Again, you want to not contaminate that port. Remove the spike cover. And you want to take your spike and put it through that seal. So you're going to push and turn. To where your spike sort of widens out so that your spike has pierced into that bag of fluid. And if my roller clamp's closed, the fluid isn't gone anywhere. So the next thing I want to do is I want to prime my drip chamber. So I've spiked the bag and now I'm going to squeeze the drip chamber and fluid will come in there. And you'll see when you get close to it, there's a little T on some brands that tells you that's approximately how high you want it to go. What you want to keep in mind though when you're priming drip chambers is you want to do probably no more than half, because you want to be able to see the drips when they drip out. So then we want to look at our tubing and make sure that it's not all tangled as mine appears to be. I'm going to untangle this here for a second. Now it's not so tangled. So I can see what I'm doing and not have to go a bunch of loops. Okay, so I have it untangled, I have it spiked, and I want to be able to wash this. Keep control of my end so it doesn't get contaminated. Keep control of my roller clamp. Once I open this roller clamp, you'll notice, when you do this, might be hard on the video, but fluid will come down my tubing. And what I want to do is prime it all the way to the end without wasting fluid and without churning up a lot of air in the tubing, because we don't want to infuse air into our patients. The places you'll have trouble with air will be your hard parts, like these ports. They are hard plastic, and so air can churn in there. So what I like to do is, as I'm watching my fluid come down, I will turn these upside down so they fill from the bottom up, and then watch my fluid continue. Once I get to my roller clamp, that may slow it down as well, and I may need to open it a little bit more to let it under there. So I'm going to go at a slow, steady pace. I'm going to open my roller clamp and watch my fluid start to flow. Hold that upside down. It's gone through. Now my fluid is coming down here through this to my roller clamp. See if it makes it through. And it did, but I'm going to speed it up just a little bit. And then hold that upside down until it gets to that port. Fill it from the bottom up, and now it's going towards the end, and then I'm going to close it. So I spike the system all the way from the top to the bottom, ensuring not to get air into my system and to make sure that I have primed it, because when you connect it to your patient, you don't want to infuse air into your patient. So now that I've spiked and primed my bag, if I wasn't at my patient's bedside, I could take this into their room and I can initiate the fluids to my patient. So I have my spiked and primed bag. I'm just going to put that on my pull while I'm doing this. So now I need to assess my patient's IV prior to inserting the fluids into their IV. So I would wash my hands and put on some clean gloves. For this, I need to make sure I have some alcohol pads, and I need to make sure I have a flush syringe so I can check this IV for patency. So here is my patient's IV site, this Heplock. This is my drainage system, which is just part of our mannequins. So I'm going to get an alcohol pad and open it. And I'm going to take my alcohol pad and I'm going to cleanse my hub or scrub my hub for 15 seconds. So I go back and forth along the edges and back and forth along the flat part. I can look at my clock, make sure I'm doing this for 15 seconds. If I have a watch, make sure I'm doing it for 15 seconds. I recite Twinkle Twinkle Little Star because I've timed myself singing it. It takes me 15 seconds. So 15 seconds, and then I'm going to lay that alcohol pad under that hub to protect it from their skin that I just cleansed it with. I'm going to get my flush syringe, remove the cap. If I haven't yet, I'm going to bump out some air. And I attach my syringe to my cap. And it's a Lure-Lock system, so we've done that before. You push and turn. And we want to check for patency. And we want to check for any infiltration, phlebitis, or any problems with this IV site. So I'm going to pull back. Hopefully I get a flash of blood that says I'm in the vein. And then I flush 2 to 3 milliliters. It should go nice and easy. And I'm checking to make sure that no fluid lifts up the skin. And I make sure there's no redness, no warmth, and no discomfort as I'm doing that to my patient. And that all checked out fine. So then I disconnect my syringe. Put that off to the side or in the sharps. I'm going to get another alcohol pad and open it. And I'm going to again scrub my hub for 15 seconds. So I'll say 15 seconds has elapsed. Put that under there. And now I'll get my IV tubing, which has already been primed. There's no air in it, and there's fluid all the way to the end. I'm going to remove the cap from the end, ensuring not to touch it. And again, this lure locks onto your patient's IV. So line it up, and there's a little cap that goes up and locks on there. And then we can open our roller clamp to what we would to set our fluids at. So if we're doing it by gravity, we would have done a drop factor problem, and I would count my drops per minute over 15 seconds. If I was using an IV infusion pump, I would load that and have my roller clamp wide open. But I have it set, and it will infuse into my patient. I can remove the alcohol pad, remove my gloves, and wash my hands in my patient. Just alert them that they are now connected to their IV tubing, and if they get up and walk away, that's going to come with them. But that was Viking priming and attaching to your patient.